Thank you very much. Thank you for having me here tonight. So one of the hopes here is that sort of like the idea when you look at a mountain, depending on where you're standing, you'll see different perspectives. And so one of the things that's very clear about the overdose crisis is that there's lots of different layers and different perspectives, ranging from the immediate response to overdose that could be happening right now in this building to where is this going over the next 10 years, and as citizens and also people involved in care, what do we need to be paying attention to? So I just want to highlight a few ideas and hopefully put some of this into a different kind of perspective. I just want to comment very briefly, and this has been based on some of the questions that people bring up. I've noticed that sometimes there's a bit of a muddle or a confusion between ideas and activities that really fall in the world of prevention, and then there's ideas and activities that involve the world of treatment. And I don't want to suggest there's a wall between the two worlds. They're very different realities, and they require very different understandings of addiction. Probably what a lot of people know, and a lot of other people don't know, is that generally prevention has nothing to do with drugs. Prevention has more to do with the kind of world that we have and how young people experience that world. And prevention has more to do with what matters in this world. And it turns out that people knowing things about drugs is important, but it turns out it has very little to do with what makes prevention effective. Drug treatment, strangely enough, too often doesn't have anything to do with drugs. As many people know, there might be some people in this room who've experienced the journey of recovery. Recovery is essentially everything to do with life except drugs. It's about a person reclaiming a sense of value, a sense of dignity, a sense of belonging, a sense of worth, a sense of vision or hope for what it means to be here on this planet. And often that has nothing to do with drugs. So I just want to underscore that when we bump up against the overdose crisis, we also have to be aware that there's a context that goes way beyond fentanyl. The other thing that I think is important to acknowledge, this is based on my observations of the fentanyl overdose, there's a lot of strong reactions. Some of those reactions are fear for people. Some of those reactions are angry. Some of those reactions are even hateful. And I want to acknowledge that as human beings, it makes perfect sense that we have reactions. We cannot stop being human. We cannot stop having emotions. And also to acknowledge that the suffering and damage of addiction is real. And it's no wonder that we're reacting. This has been a front and center issue in our society for some time. These are just an example of some of the reactions that I've witnessed in our society, in the media, at public forums. And they're all valid reactions. So one of the things that we can sort of ask ourselves, what are my reactions to what's going on here, and what is the basis of those reactions? But there's another dimension around these reactions that's important. And this is where I'm particularly interested in, is that despite all of us having a legitimacy or a right to have our feelings and reactions about things, it is important, and I believe there is a responsibility that we have as citizens, and especially the people involved in care, to realize that not all of these reactions are effective platforms for prevention or effective platforms for treatment. So it's important to make a distinction about, as human beings, how we have reactions about drugs and drug use and all the terms that we use around it, like addicts and addiction and crisis and epidemic. Those are all strong words that bring up powerful feelings. One of the things I do wonder about is that despite our fears and reactions, it's getting back to this sense of, so what responsibilities do I have? And how do my reactions possibly land on people? So if we think about the question is, how do we show up in the lives of people who are hurting? How do we show up in the lives of people who are suffering with problem relationships with substances? And how does our showing up have a prevention effect, or in the case of treatment, how does it promote or support healing? One of the pieces, I thought the slide was there, but I don't know if people have noticed this, but some of the reactions that have happened around this have not only not been helpful, but they can become potentially damaging to people. And the reason for that is that we're thinking about effective prevention, and this is true to some extent around treatment. There seems to be three factors. There's lots of different ways to think about and talk about this, so this is just one way to think about it. But if we're really interested in trying to help people be well, there seems to be three factors in particular that are associated with wellness. The first is connection and belonging. So if we think about some of the people in our society, particularly some of the people who suffered most with fentanyl overdoses, the extent to which people feel a sense of being valued, a sense of being belonged. Raises the question, as a society, as a community, how do we ensure each person has a place? And so if you speak with people who've had long-term problem relationships with substances, one of the most common things you'll hear is that people not feeling a sense of belonging, not feeling a sense of being valued. The other piece about healthy communities and helping people be well is ensuring that each person has an opportunity to contribute. And that goes beyond just contributing economically. So there are many people in our society that are struggling to find opportunities to contribute. Not because they don't want to contribute, but because society does not see the value that each person has. So we need to do a better job of helping create opportunities to ensure that each person can contribute. The other piece, and this connects with prevention. So one temptation has been in the past is to tell people or lecture people about what they should be thinking and what their values might be around drug use. For example, in the past with drug prevention, there was the idea of making healthy choices. But I think we all know what the right choice was. So it turns out is that deciding people's values for them or deciding what correct behaviors are is not a particularly effective way of helping people be well. What seems to be most important is how do we support people, especially young people growing up, figure out what matters in this world. Helping people develop a sense of standards or responsibilities for one another. What does it mean to be human? What does it mean to have neighbors? What does it mean to care about another person? So it turns out that one of the most important prevention factors we can have in our society is helping sure each and every person sees himself first and foremost as a citizen. And citizens have responsibilities. We have standards in this world. And a healthy community has standards about what it means to treat other people. For example, with compassion and kindness. I just wanted to comment very briefly too that this doesn't mean that drug education is not important or drug education in and of itself is ineffective. What I want to emphasize, what the research is showing, is it's not the drug education per se that's important, it's the context in which education takes place. And this fits with that third thing I'm talking about, people developing a sense of standards. So our conversations with each other, with young people, is not so much about making sure people understand what the facts are, but helping people develop an understanding of how to bring those facts into their life. And it's something that we haven't talked a lot about in overdose crisis, but it's not an unusual phenomenon for people, because I know this because I've witnessed it. I've spoken with people who have overdosed, and they have literally been brought back to life because of the care of medical professionals or first responders. And afterwards, say a day or two down the road, they may be leaving the hospital, leaving care, is that the person is not happy or grateful that they are alive. I think it's important to recognize that even though we can give people information, is that sometimes, and this is true for we think about school systems and our healthcare systems, is how do we ensure that each person not only is receiving information, but recognizes their value and sacredness as a person. And there is a growing concern about some of the messages that people are getting, especially people who have overdosed. Certainly I've witnessed myself people who've overdosed hearing things that are not caring and they're not respectful. And I think it goes far beyond stigma. Sometimes stigma is a polite way of saying is that sometimes also want to put things in perspective. I get this a lot, or I hear this a lot, that sometimes there's this feeling that we're in this sort of like whirlpool of spiraling epidemic of addiction. And that is just simply not the case. I think it's important to point out there's some good news here. The game changer, as Dr. Tyler has pointed out, is the lethality of fentanyl and fentanyl elements. That is real. The deaths are real, and the lethality and danger of fentanyl are real. But if you look at the bigger picture about substance misuse, particularly around the lives of young people, there's lots of good news. And I think that does reflect that our communities are doing a good job of caring. I think it does reflect that our school systems are doing a much better job of helping students feel a sense of safety and a sense of inclusion. Anti-bullying campaigns are a really good example of that. The way in which schools accept people of all faiths, all colors, all sexual orientations, those are all movements in the direction that have contributed to the reduction of substance use. I'm sure some of you will remember, it wasn't that long ago, we were talking about a methamphetamine epidemic. Well, the good news in the last 10 years amongst youth in British Columbia, methamphetamine use is down in half. And it's kind of a good news, bad news situation is that heroin or opioid use is unchanged. But the number was never that great to begin with. So the good news in there is not increasing dramatically. So that says that we're doing some things right. But more importantly, it also says that there are resources and wisdoms and values that young people carry within that are also protected. Just in terms of some very general ideas that are applicable for everybody, what these ideas mean can be interpreted differently for different people. But here are some of the things that we do know that, especially when we're concerned about young people, is the importance of being fully present in the lives of young people. And by that, I mean it is paying attention to listening. Is even though, whether parents or teachers or other adults, even if we're scared, it's important that we keep our hearts and minds open, because when they're closed, we can't hear. We can't really understand what's going on for people. It's also important that to accept that I don't think right now any of us have the right answers for everything. Is that there's a certain process of discovery, and young people in particular are part of that process of discovery. The other piece I just want to touch on very quickly at the bottom is that one of the things that's probably most important in this crisis, this overdose crisis, is that we all have a role to look after each other. One of the slogans that we've been using is in the past is that friends don't let friends drive drunk. We're kind of putting on the idea that friends don't let friends party alone. People probably heard the idea that isolation will kill you. That's particularly true in the midst of the fentanyl crisis. These are the words from a young person who's been very much in the front and